Okay, tubular reabsorption, which is the second step for urine production. So during the glomerular filtration, a lot of substances from the blood goes into the kidney tubule. Now we want to collect some of them back. For example, we collect them through this peritubular capillary. Peritubular capillary will reabsorb, for example, sodium by active transport. It said that 65% of the sodium will be reabsorbed by the sodium. It should be higher. We saw that it is 95% in previous slides. I don't know why it said that 61 by active transport. I guess sodium will be reabsorbed by other mechanism. Well, active transport. But that is the major mechanism. That is the major mechanism. And then chloride also follow passively reabsorb. Now, when our blood reabsorb a lot of sodium chloride, it will cause our blood to increase the concentration, and then osmolality of the blood, you may assume that it is the concentration of our blood, so that the water will follow by osmosis. This is something that I told you, the principle of of the physiology of the urinary system. Our kidney control the reabsorption of the sodium so that the water will follow the direction of sodium by osmosis. If, in this case, the sodium is reabsorbed from the kidney tubule back to the blood capillary, then the water will also go from the peritubular, it will go from the kidney tubule back to the capillary by osmosis. So this is, water always follow the sodium, the salt. What about nutrients? I mentioned the nutrients, they are glucose and amino acid. They also go back to the blood, but it requires carrier protein. So it is not, the carrier protein will do that. Glucose is completely reabsorbed. If you have too much glucose in your blood, then it will be excreted because all the carrier protein, they will be at the maximum capacity of absorbing the glucose. And if you still have more glucose in the kidney tubule, then the carrier protein cannot absorb the excess glucose. In this case, then you have no choice but to excrete the glucose. And then that's the case of diabetes. So it says that if the carrier protein hit the maximum rate of transport, that means all the carrier protein, they're at the full 100% of the workload to reabsorb the glucose. So in here it says that in diabetes, excess glucose is present in the blood because liver and muscle, they fail to store glucose as glycogen. Yes. One of the reasons type 1 diabetes is that the body, the pancreas, cannot produce insulin. When type 1 diabetes is like the people who are born with these defects, the pancreas cannot make insulin. When pancreas cannot make insulin, then the liver and the muscle cell, they cannot convert glucose into glycogen. So that those patients, they will have a very high blood glucose level in the blood all the time. Because the kidney already at the maximum workload for reabsorption, so that then the kidney cannot reabsorb all the glucose in the filtrate. Therefore, it will increase the osmolarity of the filtrate. That means your filtrate, that means the urine, the filtrate will become the filtered urine. Okay, the filtrate in the kidney tubule, they are the filtered urine. That means it will increase the concentration of the filtered urine. When your urine is become concentrated, what will happen? Water follows. Okay, water actually, I don't like to use the word reabsorbed into the nephron. I would say secreted. So water will be secreted into the nephron. In this case, the diabetic patient will have this symptom of frequent urination because you have more water secreted into as a urine. Because the patient urinate a lot of times, the patient will feel thirsty all the time. Because the water is leaving the body. The patient do not get enough water into the blood. So reabsorption, what will reabsorb? Most of the water will be reabsorbed. And the nutrient, namely glucose and amino acid, will be reabsorbed and required ion. Because if we absorb most of the water, that means most of the sodium chloride will also be reabsorbed. Nutrient, as I told you, glucose, if it is a healthy individual, 100% of the glucose will be reabsorbed. What will go to our filtrate or the urine? A little bit of water, most of the nitrogenous waste, namely what? Ammonium, urea, uric acid, and then excessive salt. Okay.